You're listening to Healing Voices Project, where we share stories and the latest information from people who fight addiction every day. I'm Mike Torville, your host and author of Voices from the Fallen. Thank you for listening, for following, and most of all, for sharing with people you care about. Make your voice count too. Hello everybody, thanks for joining us again at Healing Voices Project. We have a guest today. His name is James Biscoe. He is the Senior Area Manager at Clean Slate, the Clean Slate centers throughout the Northeast, and it's a really great organization. And James, thanks for joining us.
Thanks for having me, Mike.
Sure. Now, in addition to your work at Clean Slate, you've also got your own personal experience, what led you to this job. We'll get into all of that a little bit, but we really want to hear what Clean Slate is all about.
Sure.
And if somebody's interested in finding out more, how do they reach you? So I think, first of all, let's tell about the website. It's cleanslatecenters.com.
Cleanslatecenters.com, absolutely. That's where you can find where all of our centers are located. You can make appointments straight from the website. We have a chat feature, so if you don't have the time or feel like staying on the phone with somebody, you can do that right from your phone. You'll get a live agent who will help you book an appointment right now or just learn more about what services we offer.
And why would someone call Clean Slate versus, I mean, there are so many options and it gets kind of confusing, right?
Absolutely.
Which treatment center, which program, which rehab, how do I know I should make a call to Clean Slate?
That's a great question. There are many paths to recovery, and everyone's journey is very specific and individual. So our personal mission was to provide outpatient opioid and alcohol-based treatment using FDA-approved and proven medications like Suboxone and Vivitrol. We do not do any methadone at our center. That's just a higher level of care that outpatient setting's not really the best for.
Yeah.
So if somebody wanted to learn more about how to do that, sorry.
That's all right. We get noise all the time. Mine's going to ring too, so.
So it's an outpatient setting. You make an appointment, you come in like a doctor's office, you'll be evaluated by a addiction-trained specialist.
Yeah.
All of our physicians are board-certified addiction specialists. Our nurse practitioners and physician assistants are all addiction trained. And then we have our licensed drug and alcohol counselors and our care coordinators who coordinate the care, will help with any social barriers, housing, transportation, all of the really big barriers that people have
Things
to recovery.
Things that get in the way
Absolutely.
of somebody having the ability to get treatment. Now, you said several key words there.
Yeah.
You said licensed, you said trained, you know, certified. And the people at Clean Slate certainly have gone through extensive training, education, and so on. And this is why, I think, one, you have a great reputation. Two, you're growing. And I know there's been a lot of, centers that have closed recently, and maybe there's some great people that have worked there, but the circumstances being what they are, didn't work out. Now I think that might have brought some skepticism or apprehension about, is this center reputable? Is this somewhere where I can trust? And Clean Slate has been there for 14 years,
right?
And growing, and with your certified, trained, licensed people, you've got some depth of experience to work from.
Absolutely.
Yeah.
I feel that's one of the many things that separates us from those centers that have unfortunately been in the news for closing.
Yeah.
It does kind of paint all service providers in a skepticism or with a broad brush.
Mm-hmm.
Like I said, what differentiates us is we have licensed, trained medical providers and behavioral health providers. We are CARF accredited in all of our centers throughout the country. For Massachusetts specifically, we're licensed by BSAS, the credentialing body for Massachusetts, the Bureau of Substance Addiction Services. And we've been around since 2009. We're not going anywhere.
And you've been at Clean Slate for 6 years now?
6 years.
Yeah. Seen any changes in 6 years?
I've seen a lot of changes in 6 years, yes.
Yeah.
We're now have over 80 centers open nationwide, and we're in 9 states.
80?
80.
You started with one.
We started with one.
In West Springfield.
Correct.
And now you have 80. Something's going right there.
It's kind of a double-edged sword because it's a sad thing that we are needed in so many places.
You know, and we talked about that yesterday, and yeah, you're right. It is. It's the good news that you're able to. But wait, unfortunately, it's needed, and unfortunately, you're busy. I mean, it'd be wonderful if you weren't, if you had no clients, because then there'd be no need to state the obvious. However, the fact that you're accessible, available, is making a difference.
It's definitely making a difference. We passed a milestone fairly recently at Clean Slate where we've helped over 110,000 people nationwide get into recovery. So,
wow,
over 14 years, that's a good chunk of people.
Yes, it is. What brought you there, by the way? And what you do before you went to Clean Slate?
That's a good question. Yeah. So I started my adult professional career in medical assisting. I started in 2008. I was a medical assistant for what was Hampden County Physicians at the time.
Anything to do with substance abuse?
Nothing to do with recovery.
Okay. Yeah,
I was interested in the medical field, and that's what brought me there. The unfortunate part about Hampden County is they wound up going out of business. They went bankrupt. They were bought by Mercy. Medical group at the time, so Sisters of Providence and Trinity took over. I progressed my career there and went into management back in the 2010, I think, was my first manager's position. From there, I transitioned to an urgent care, which was a great experience. Urgent care is a very fast pace.
Yeah.
You see a lot of really neat things when you're in the medical field at an urgent care. And then I saw a job posting for Clean Slate, and to be honest, I had lived in this area for my entire life, and I had never heard of it. And that was about 2017.
Wow. They had been around at that point for 8 years.
Right.
And I can do the math.
Exactly.
But after 8 years, but you probably didn't have a reason because you weren't involved with substance abuse or recovery, so you didn't have a reason to know. Honestly, I didn't know either.
Yeah.
Until involved, but you don't have a reason. You don't know until you have a reason to.
Well, the ironic part about it is, I myself am a person in recovery. I've been in recovery for 19 years now.
19 years. Wow.
And I had never even heard of Clean Slate. Never mind that they had 5 offices directly in my area. So it was interesting to me, and I have a very personal relationship with recovery, so it seemed like a perfect fit for me. So I applied, and I had my first interview, and they told me all about what they do, their mission, how they tackle the recovery.
Yeah.
And I've been there ever since.
You said, I think I can work through this because, one, you've had your own experience.
Right.
And you can you can see that. Now, your own, I'll talk a little bit about what you had gone through. It's been 19 years.
Yes.
You're a young guy, so
yeah.
Whew.
Yeah, you can you can do the math.
Yeah.
I might not look as young,
again?
but
You're gonna do math again.
Yeah. Actually, I started down the road to addiction when I was 14 years old. I think I took my first opiate, and it was prescription pain medication.
Yeah.
For something I was prescribed. And it's the story you've probably heard a million times.
You were prescribed because of an injury?
Yeah. Yeah. I played sports, and I had an injury, and the doctor at the time, it was a very small amount of a very mild opiate, but it was like my world changed that day, and I made bad decision after bad decision, and from 14 to 19, it was a Nobody ever wakes up one day and says, hey, I think I'm going to be addicted to heroin today.
Right.
But it's those small decisions along the way. And I always had this, from the first time I took an illegal substance, had these lines that I told myself I'd never cross. Well, I'll do this, but I'll never do that.
How did that go?
I crossed every one of them eventually. So it's you can limit set in your head as much as you want, and you can have the willpower that everybody talks about, and that doesn't matter. It goes out the window. So, long story short, I found myself at 19 years old addicted to heroin and losing everything that was important to me.
Meaning relationships?
Meaning relationships, my family. I had ruined all of that. My sports career, I threw that down the drain. The friends and that I had lost along the way. By the time I was 19, I had seen five people pass away.
From overdose?
From overdose, yep.
People close to you?
Very close.
But did you keep using?
Yeah.
Despite that?
It's one of those catch-22s, I guess, because it just sends you deeper into.
And that's the whole definition of addiction.
Yeah.
Despite all these adverse consequences, you still continue to use.
Right.
So this went on to a point. What brought it to the end?
The funny part is of all the negative consequences from the years of using, it was the smallest thing that brought me to the point where I wanted to change. It was just one day I woke up and I was feeling terrible, and I was just sick of feeling terrible every day. And I took the first step to talk to my mom at the time.
Mm-hmm. Was she aware?
She was aware, but she was in denial aware. She knew that there was
common.
A problem.
That's
right.
why, okay.
Right. She knew there was something wrong, but she didn't really know the extent of what was wrong until I had that conversation. And we worked to get into, at the time it was Providence Detox. Mm-hmm. And I went through there and I came out. And I'm a very lucky story because I made it through my early addiction without any legal consequences, which is very rare. Yeah. Doesn't happen very often. Mm-hmm. And the first time that I went to treatment, I stayed in treatment. And
it never looked back.
No.
Well, that's rare too, and you're right.
Very.
You're one of the, I call it lucky ones, but right.
Yeah, it's luck, but it's a lot of work.
It's right. It doesn't mean, wow, I got lucky today. No. You certainly overcame some challenges and hard times.
Right.
It's never easy. But what you talked about earlier, the willpower and crossing the line and your inability to recognize that and stop.
Right.
But this time you did. Something changed in your head that said, I recognize those lines. I'm not going to cross again. And you were tired of getting the dope sick feeling that you were just encountering on a daily basis instead of, I've had enough.
Right. It's like the worst flu you've ever had on a daily basis. And there was just only so much I could take of it. And that was the worst part for me. I mean, all of the other consequences didn't seem as bad to me as feeling sick. Yeah. Which is weird. I know.
Well, that's actually common, as you know from speaking with the multitude of people that you speak with.
Yeah.
So you went through your treatment. You came out of it. Were you working at the time?
At the time that I went in, I was delivering pizza at the time.
Okay. You were delivering pizza at the time, and you kept working, and then did you go back to school? Did you get into healthcare, though?
I did, yeah. So I got out of treatment and went into medication-assisted treatment. So that for me was the catalyst. Is I was able to work through my issues that led me to the substances while not having to feel sick.
Okay.
Yeah.
And
I don't think if it was for that, I would have been able to.
Right.
And I did continue to work. I bartended for a little while, which might seem counterintuitive, but it was...
You're just pushing your luck, weren't you?
Yeah.
Yeah.
Yeah. But it was, I didn't have many options at the time.
Yeah.
So I did that while trying to figure out where I was going to go as an adult.
Yeah.
And then, truthfully, my aunt got sick. She got very sick with pancreatic cancer. And it was a very fast, but within 3 months from diagnosis, she had passed away. And that was my reason for getting into the medical field, because I watched the nurses take care of her and just made that experience so much kinder and gentler for her and us.
Okay.
That I wanted to be a part of that. And
yeah.
I didn't have the training to go be a nurse. So
okay.
I went to school and I got my certificate for medical assisting. That was my foothold.
Yeah. Well, that obviously led to where you are now.
It did.
Yeah, yeah.
It did. It's not where I expected to go, but I got here.
Yeah, yeah. And when you were 19 and in the throes of your addiction, again, we say this often, you not in a million years could see yourself doing what you're doing now.
No, I didn't. Yeah. At that time, I didn't even know this was a thing. I didn't know there was a recovery community. I didn't know there was help for people like me and what I was going through.
There's so many people that I've met with and talked with and interviewed and written about, and that's such a common thing.
Yeah.
And I'm thinking, people don't know until there's a reason to know, and by then often it's too late. So as we try to get the word out, I say, what should you know in advance, or at least when you suspect, or at least have an inkling that, like you talked about your mom earlier, who was aware, maybe in denial, and maybe aware a little bit, but didn't talk about it. Maybe she was afraid to ask. Maybe,
right.
And that's so common, because if they know, no, I'm sure he'll be fine. It's sort of a denial. But rather than maybe a little research, find out, well, what if this person, my child friend, is going through addiction because there's something that's not right. What should I know? Who should I call? And people don't know where to start. If a family member suspects another family member or a friend or somebody, something's not right. I don't know if he's addicted to pills or heroin, but his behaviors are. What does a family do, especially when they don't know, like you didn't know either? Who's the first call they make to find out information?
It's a very good question. Yeah. Thankfully, there's a lot more services nowadays than there were even 10 years ago. Mm-hmm. I mean, we have some great organizations for families of people who are using substances, like Learn to Cope.
Yep.
They are a
great group.
Great family support group.
Yeah.
I tell people about them all the time. And that's something you can check out even if you don't know. They have a lot of information. The BSAS website itself has...
BSAS is
BSAS.
Yeah.
It's the
BSAS.com.
I believe it's .gov.
.gov, okay.
Yes, because they're the Bureau of Substance Addiction Services.
And people can at least Google that to find out they're more...
Absolutely.
And also I'll do a little shout out to Learn to Cope, because that is learntocope.org or .com.
I believe it's .org.
I think it's .org, but Learn to Cope is a great organization too. But
mm-hmm.
And it's great to visit their website to learn more, because there are a group that families can, as a resource for families.
Absolutely,
So, yeah.
and addiction is a family
exactly.
disease. It
right.
affects
this is
everybody.
Why, yes, yeah. And so if a family, would Clean Slate be a first call? Or
it could be.
Yeah.
That we have great information on our website
mm-hmm.
About treatment options. It's specifically for our treatment options, which might not be for everybody, but
right.
for who it is for, we have people you can talk to. We have, like I said, our live agents can get on and
yeah.
chat with somebody just to see what their options are.
Yep, and at least redirect or refer
Absolutely.
to someplace else. And I hate to sound like a commercial, but there's a Clean Slate Clean Slate center near you, meaning
there is.
There is.
Yeah.
And because you rattled off the towns in Western Mass that they're in, started in West Springfield. But if you call and say the website again, cleanslatecenters.com, and the number is 833-505-4673. It's a good time to remind everybody since we're talking about that.
Yeah.
But it's a good place to start anyway. And if Clean Slate isn't the right option, someone there will actually direct or answer questions and provide information.
Absolutely.
Yeah. There's so much that I found until someone has a reason to inquire, it can be like their head's in the sand.
Right.
I don't mean that to sound negative, because my head was in the sand a lot because I didn't know. Boy, my eyes were opened after hearing and speaking with and writing about this. I said, my goodness, it's all around, and there's so much of this. And what I've recognized more than anything is a lot of people don't know what to do, and the people who've gone through it, especially in the book that I had written called Voices from the Fallen, what I thought was a common theme is we didn't know what to do. We made a lot of mistakes, and boy, did things go wrong.
Yeah.
Right? Pretty common, right? Now, with a couple other thing I wanted to ask you about, because we talked about Xylazine, and certainly fentanyl is so dangerous, and it's not really the heroin that it used to be. The fentanyl's in there, but now we're seeing a lot of Xylazine. You want to talk a little bit about what you're seeing with that and the effects of that?
Yeah, the Xylazine, it's not a new problem, but it's a newly publicized problem, and it is getting worse. And the real danger with the Xylazine is that it's a non-opiate, so the naloxone doesn't, or Narcan doesn't have the same effect on it. Mm-hmm. And it's very prevalent now to be mixing that with the fentanyl or heroin. And the other real danger with it is it does rot the tissue around where it's injected. It's got a vasoconstricting property to it inherently. Mm-hmm. So the wounds and the abscesses that are being caused by it are just terrible.
Yeah, I've heard that even in some cases it can get so bad that amputation has to happen because it can spread and get that infected.
Yeah, it's that scary.
And because it's resistant to Narcan,
right.
Narcan is being administered and the person's not responding.
Right.
No one's going to think, oh, there must be. They're not knowing what to do and maybe panic and say, what's wrong? What's happening here?
Right, because it's a tranquilizer, and it's a tranquilizer specifically designed on large mammals like horses. Mm-hmm. It's not going to respond to any of the reversing agents that we have currently, but the effects of it do look very similar to an overdose, and it's a central nervous system depressant, so adding it to another one of those like fentanyl is just a bad combination.
You think things couldn't get worse. You think
always
it can't be any worse than the fentanyl and what's happening,
right,
and the deaths, but yet this has made it worse.
Right.
That's awful. And yet, as like you said earlier, there's so many things that you say, well, there's so many rational things you can get in your willpower, all these things that just don't go. You could know there's fentanyl in there, people will still decide to use. You can know there's xylazine in there, people will still decide to use. That's just so hard to think about, playing Russian roulette, and really how dangerous. It's just compounded the danger, I guess.
Yeah, absolutely. I mean, that's the key characteristic for addictive behavior. Is just that there's things that seem rational to you when you're not in the throes of it are just out the window when you're in the throes of it. You know that there are negative consequences and you ignore them.
Yeah. Are you seeing more of the effects of that, or more of that mixed in than it used to be? Because you said it's not really new, but it's just being more publicized now. Is that?
I think it's gotten to the medium more, and it is higher cases of it. Mm-hmm. I would say. I don't see them a ton personally. Our form of treatment is more designed, like I said, for an outpatient basis. Suboxone was created for people who are highly motivated and not needing to come in every day and dose in front of somebody like a methadone.
Okay. Yeah, and let's talk about that too, because I did want to mention that earlier and I forgot. Is Suboxone, how does it work? How is it different? And how are the treatments applied? And what can people expect? There's like 3 or 4 questions in there.
Sure.
What can people expect when they go to Clean Slate and that type of treatment? How does this all work?
Yeah. So I'll preface this by saying I'm not a medical doctor, but Suboxone works by attaching to the synapses in the brain. Mm-hmm. It's a partial opioid agonist, so it's not a full opioid like methadone is. Okay. It's a partial agonist, but what it does is it binds to the receptors better than a traditional opioid. So one of the risks of starting Suboxone treatment too early, so if you're actively using and then you take Suboxone, the buprenorphine will actually knock the opioids off the receptors.
Buprenorphine is the chemical.
It's the active ingredient in Suboxone, right? Yeah. So it will actually knock the opioid receptors off and bind themselves, which is a partial agonist, which can then put you into what's known as precipitated withdrawals. Mm-hmm. So when somebody comes to begin treatment with us, their first appointment is typically a consult with the physician, who we will...
A staff physician,
right? Yeah. Or physician or nurse practitioner or physician assistant, a medical provider. Mm-hmm. And they'll provide a urine specimen, which we test on the spot just to see what's in there. We don't disqualify anybody for what's in there. Obviously, we know you're coming for help.
Right.
But what we don't want to do is start the medicine while something is still actively in your system, especially fentanyl or methadone, the ones that are really predominant and can really cause some major precipitated withdrawals, which is like withdrawals, but times 10. If you want to have a simple explanation, you know, it's uncontrolled vomiting, and it's really a nasty thing. Mm-hmm. So that's not to say you can't start the medication on the first visit. If they meet with the provider and they administer it's called a COWS. It's a withdrawal scale. Okay. So they have to make sure that you are just enough in withdrawals to start the medication safely, but not so much that you need to be terribly sick.
And to get it's a simple question, but how is it applied? Is it an injection? Is it
Suboxone is sublingual, so it's under the tongue.
Under the tongue,
most of the time.
A lot of people don't know that, and it has to sit there.
Right. That's one of the very common things about our treatment is people get impatient when they're taking it, mm-hmm. or they just don't know the proper dosing technique. Mm-hmm. So it's 10 to 15 minutes beforehand, no eating, drinking, smoking, anything, and then you take the medication under your tongue, and it has to sit there. Usually we tell people, like, the prayer position, have their head down a little bit, because you don't want any of that spit to go down your throat. It all has to sit under the tongue.
So counter gravity, make it sure it goes this way instead of that way.
Correct.
Yeah. Okay.
There's 2 large veins under your tongue that absorb the medicine.
Okay.
So it sits there for 15 minutes. After 15 minutes, if it's completely dissolved, usually it's okay to swallow it then. If it's not completely dissolved, make sure it is dissolved. And then, just as important, for 15 minutes after, no eating, drinking, anything, just so any residual that's left in your mouth gets absorbed.
This is a 45-minute process.
It can be. Okay. Absolutely.
Yeah. All right. But if it's not taken the right way, it's ineffective. So
right, yeah. And it's something we see a lot. People come in who have been on the medication for some time, or have been taking it on their own, and think they need more of the medication when really it's just improper dosing technique.
Yeah, that's important. That's why I wanted to have you share that.
Yeah, no, it's a very good point.
So, how often is this required, and is it something you wean off over time? How does the
everybody has a different
okay
treatment plan.
Yeah.
So we've had people come in who are successful in taking the medication for 6 months, and then they want to wean off slowly, and they do that successfully, and that's it. It's maybe a year process. And then we have some folks who that might not work as well for them. I mean, there's really no timetable to recovery, and our treatment in particular, people can come off the medication as slowly as they want. The good thing about it is it usually comes in a little film strip that you can cut into very small pieces, so you can go down as slowly as you want. You can come down a 0.5 milligram a week, or 1/4 milligram a week.
But it's a self-administered.
Yes,
Take it home.
it is.
And but directions are critical.
Directions are critical. Being honest and open with your provider is just as important. You know, we don't judge anybody. So if you are trying to wean off the medication and it's not working and you need to go back up, that's okay. You know, it's not a failure of your character. It's just everybody is different. Everyone's biology is different. Some people who have started using at a really, really young age, it changes their brain chemistry. Some people might never get that back. And that's just a reality. So some people might need to be on medication forever. Not everybody, but...
Yeah, and I guess the chemistry of everybody's body is different. That's why some people are allergic to certain things or like certain foods. I mean, there's so many variables there that you could use all kinds of analogies. But the point being, they can't expect a definite outcome over a certain structured time, because the expectation is this may be different. So if you were going to set some reasonable expectation, this could take up to a year. Prepare for that.
Yes.
And what would they expect for how they feel and their cravings, or how would that aspect work?
That aspect, the medication is proven over the years to be very effective in eliminating your withdrawals completely. It should cover your cravings. You shouldn't have, if your dose is correct and your technique is correct, you shouldn't have any. There should be no withdrawal symptoms.
Okay.
It covers cravings. It completely binds to all the receptors in your brain. It covers them. So there shouldn't be any of it.
And the difference, again, will go back to methadone, which is more of an inpatient and controlled and administered on the premise. This is different because it's more of an outpatient administered treatment.
Right.
Yeah.
So methadone doesn't need to be administered inpatient, but they typically will have people come in daily to dose, at least for the beginning, and they can work up to getting bottles of take-home medicine.
Yep.
Usually it's up to 6. I think they've recently changed that, but it depends on the clinic.
Yep.
For our treatment, you come in, and initially we'll see you usually once a week. And we see you once a week for about 8 visits until we see that it's working. Your urine drug tests are negative for anything that's not supposed to be there. And then we can move to every 2 weeks. And then it's the same process for 8 visits of that. And then as long as everything's still going well, you're showing signs of progressing in your recovery, still not having anything that's supposed to be there, the frequency will get up to once a month.
Okay.
So you can come in once a month, meet with the provider, meet with your counselor. If you have a counselor with us. If you have an outside counselor, that's okay too. And then you have a prescription that you take home, and you come back once a month to see us.
Here's a question. What could go wrong?
What could go wrong?
Yeah.
There's some things that can go wrong. A month is a long time in between.
Is there a common thing that mistakes people make that cause things to go wrong?
I think the major mistake I would say is the folks who think that just coming in and taking the medication is going to solve everything. The medication is a piece. It's an aspect. The counseling is just as important. Having support systems outside of the medication are just as important. Making connections. I think that's really the opposite of addiction is connection.
This is not a quick, easy, take this and you're done.
No.
There's this one part that you said. Yeah.
Right. Recovery is work.
Yeah.
It's a lot of work, and it's hard work, but it's worth it.
Well, it's worth it. Everyone who, like yourself, you say you'd never in a million years go back. It's always worth it.
It's always worth it.
So easy to say.
It's definitely easy to say, and even 19 years in, it's an active choice you have to make every day.
Yeah.
It doesn't ever go away. It will still be there. You have to be vigilant.
Yeah. Well, it's obviously successful, and you guys are doing some great work. Again, if anybody wants to find out more, cleanslatecenters.com, and the number is 833-505-4673. And we're talking with James Biscoe from Clean Slate. Anything, James, we didn't get to talk about that was on top of your mind?
It's a good question.
Yeah. Put you on the spot there, but
yeah.
I think we covered a lot.
We covered a lot of bases.
Yeah.
I feel like I may not have done enough justice to my organization. My organization, I feel like, we're not better than anybody else. Our recovery path is one of many. I love where I work because I see the passion that our employees have. We worked through some of the hardest times ever going through the past 3 years during COVID.
Right.
And everybody came out the other side much stronger, and we're just happy to be here to serve the community. That's all.
That's great. Well, you're doing great work, and again, I think everything I see and hear about Clean Slate is great, and you are making some great headways out in the, we'll call it the Midwest, the Indiana stretch of states there, right? Because I think you're really just growing with 80 centers.
80 centers nationwide.
Yeah.
The Indiana stretch in particular, they don't have a lot of services out that way. So for us to be able to go out there and serve that population, we have patients I've heard that travel 4 hours one way to get to our centers in some states.
Wow.
Because there's nothing in between.
Wow.
So it's an 8-hour travel time for them.
Yeah.
Just to be able to access.
About a 20-minute drive.
Right. We are so fortunate in where we are that, you can throw a rock and hit a recovery center, which is good.
Yes. You're right. Yeah. Well, that's great. Great information. Thank you for sharing all that.
Thank you.
And also thanks for coming, because you're, as a guest, I'm going to give you a copy of my book, Voices from the Fallen.
Oh, fantastic.
Which hopefully is a very relatable stories, and please share, with people that you think it'd be meaningful for.
I will.
Well, thanks for coming on. Appreciate it very much.
Thank you very much, Mike.
And remember, cleanslatecenters.com. And thanks, James, for coming. And thanks, everybody, for listening. We'll see you real soon. Thanks.